So, hello students, welcome once again to my YouTube channel. And in this video, we will be discussing about the gastroesophageal reflux disease. So, gastroesophageal reflux disease basically it is a kind of a gastric disorder in which the lower esophageal sphincter loses its control, and the contents of the stomach they get regurgitated into the esophagus. So most common symptoms are the patients will be complaining of a heartburn, and in certain patients this can even lead to dysphagia. That is, they have difficulty in swallowing the food. So most of the times when we look at the gastroesophageal reflux disease, it can be classified into two types. First is the non-erosive type, which is not going to cause any ulcerations or erosions of the mucosal lining. Next is the erosive type of gastroesophageal reflux disease. So, in the erosive type of gastroesophageal reflux disease, what is found is there can occur, even in extreme cases, there can even occur erosions. So, the most common signs and symptom of the gastroesophageal reflux disease is that most of the patients who are suffering from this, they will complain of a heartburn. So heartburn is the most important finding, and heartburn, once you can get to define that this heartburn is in the form of retrosternal discomfort is there behind the sternum. The patient can have little bit of discomfort, and this discomfort is ultimately causing the symptom. So most of the times it has been found that after the consumption of any kind of a spicy food or a chili food or the most of the fatty foods, spicy foods, apart from this alcohol consumption. So such are the most important foods what causes the gastroesophageal reflux disease, and in certain cases the patients mostly complain of dysphagia. That is, they have difficulty in consumption of food, and most of the times, in some of the patients, they also complain that while lying down on the bed, so on lying down on the bed, whether they are stooping or bending or lying on the sidewise on the bed, ultimately, mostly after 30 minutes of food intake, this kind of regurgitation takes place, and this regurgitation is ultimately going to cause them the burping sensation. Even the stomach gets bloated. So burping and bloating are very important features in if reflux disease. And when the patient is reporting, so most of the times it is seen that when we perform the endoscopy, so even in the endoscopy it is seen that the clinical signs and symptoms what the patients are reporting, they there is not a correlation, because in the initial time, in the initial stages, this these erosions cannot be visualized in the endoscopy. But later on, when the disease progresses, so ultimately it takes the form of the erosive form, and there the symptoms what are causing erosions of the mucosal lining, the barrier what is protecting the mucosal lining from the acid is getting disrupted and ultimately leading to erosions. So that can be visualized in the routine endoscopic procedures. So these are the two types of the gastroesophageal reflux disease. One is the erosive type of gastroesophageal reflux disease, and the next is the non-erosive type of gastroesophageal reflux disease. So, students, this was a very short video where I've discussed that what is gastroesophageal reflux disease, how the gastric contents gets regurgitated into the esophagus just because the lower esophageal sphincter gets weakened due to certain causes. There is they become incompetent, incontinence is there. So ultimately, the reflex of the contents of the stomach gets into the esophagus, leading to esophagitis, as well as the mucosal barrier, the protective barrier, the protective factors, what are lining the mucosal lining of the either the stomach or the esophagus that gets disrupted, so leading to the esophagitis after the gastroesophageal reflux disease. So, students and viewers, this was a very short discussion about the gastroesophageal reflux disease. In the next video, I'll be discussing in more detail about the clinical signs and symptoms as well as about the treatment modalities. So, the same video I also upload in Hindi. So, if the students and viewers who are new to my channel who want the same video in Hindi, they are most welcome to comment me in the comment section. If you like this video, give this video a thumbs up. Thank you for watching.